Welcome, everyone, and thank you for joining us this morning. Just a few housekeeping items before we get started today. Today's session will be 1 hour with question and answers throughout the session. This webinar will be recorded for future viewing. Please note that participation in this webinar qualifies for free CME credit, and the CME link will be provided at the end of the webinar. Any resources mentioned during today's call will be made available after the presentation. We encourage questions and comments throughout. Please submit those questions using the chat function. If you'd like the questions to be shared anonymously in the chat, select to send to Lindsay Hanlon only, and she will be sharing those at the end. The presenters today have no financial relationships to disclose. The webinar is approved for 1 AMA PRA Category 1 credit. I am pleased to introduce our panelists for today. Dr. Lindsay Nelson is a native of Nebraska. She grew up in Exeter, a small rural farming community. Dr. Nelson knew she wanted to practice rural family medicine, and that is ultimately what led her to Henderson, Nebraska. Here, Dr. Nelson serves as the medical director and is one of 3 physicians at the facility. After residency, Dr. Nelson practiced full spectrum family medicine, including endoscopy and obstetrical services. Dr. Nelson covers inpatient, ER, and nursing home in addition to the outpatient clinic. She also serves on the board of directors for the Nebraska Medical Association. When not working, she enjoys spending time with her husband and children traveling and are avid Husker fans. Also joining us is Dr. Meg Rolfson. Dr. Rolfson is an adult cardiothoracic anesthesiology fellow at the University of Nebraska Medical Center, transitioning to an anesthesiology faculty position concomitant with a research fellowship at the University of Michigan in the fall. Her current ongoing research addresses 2 separate lines of inquiry: the association between substance use disorders and perioperative morbidity and mortality, and perioperative behavioral health as it relates to healthcare services. As an anesthesiologist interested in both the cardiothoracic subspecialty and health services research, Dr. Rolfson looks forward to collaboration and education in this space in the future. Welcome, both of you. Well, thank you so much for being here today. Just a brief introduction about yourself. I just want to have an open and honest conversation and tell the audience about how you set yourself up for success and wellness early on in your career. So that's what today is about. And I think I'd just like you to just mention briefly where you went to residency and have a quick fun fact about yourself. So if Dr. Nelson, if you'd like to start.
Sure. I actually attended residency in Lincoln with the Lincoln Family Medicine Residency Program. I was there for 3 years and then ultimately took my role out in Henderson. A fun fact, this was always hard. All throughout college, we have to come up with these fun facts about ourselves. Yeah, I guess a fun fact for me, one of the general surgeons that I work with, I've actually known for 22 years, ever since I was a little kid. And that's kind of where my love of medicine kind of came into play. So he's been very influential, as we'll kind of get to later throughout my career. But we have such a great relationship, and I enjoy working with him.
That's great. Dr. Rolfson?
Yeah, well, good morning. Thanks for asking me to be here. It's a real honor. Like Dr. Schaefer said, I'm currently in my final month of training. So I'm literally in the thick of this transition that we're discussing today. And some aspects of having being my first faculty position and being an attending that makes the decisions is a little foreign to me in some respects, but I hope to provide some insight that's helpful. My name's Meg. I did medical training at the University of Nebraska Medical Center for both medical school residency, and then I stayed on for fellowship. I went to Augustana University in Sioux Falls to play collegiate soccer at a D2 level and studied biology there. So I have left Omaha once. I took I took this position at the University of Michigan under the auspices of like a 2-year research fellowship training. I was thinking about fun facts for this, and I did not realize that that was the case, but maybe I'll get there someday.
Oh, I highly recommend it. My last continent will be in September. I'll do Africa.
Excellent.
Yes. Awesome. So, what was your biggest adjustment with coming out of residency? And I know, Dr. Rolfson, you're still you're still training, but you had that step from residency to fellowship. So that's a big jump too. So if you can talk a little bit about that jump. I know there's that meme that is like, you're an attending and you look around, you realize you're the attending, so you look for the attending or attendee or the attendee or attending. Talk about that for a minute.
Yes, yeah, in some respects, for me, the transition from residency to fellowship felt like a graduated responsibility of teaching others. I felt like I was in a role of absorbing everything and learning and residency, and then fellowship had this expectation of trying to give back that knowledge. And I found that being able to explain something in the operating room in real time actually cemented that knowledge for me more. But that transition is tough because you go from being very absorbed in the things that you need to get done, but then realizing that like there's a whole interplay at play during your work hours that it is going on a bigger scale. And to have that oversight and that wherewithal to be able to direct more than just do the things yourself um, is a real frame shift. And I think that talking to other people and really getting their input about how they've gone about it, what their pitfalls have been in the past, learning from their mistakes beforehand. You never wanted to listen to your parents when you were growing up that they made certain mistakes, but I think that that is such a wealth of knowledge, having other people around you that have gone through this transition and asking them how they navigated it. Um, those are some of the things that came to the top of mind, but
Dr. Nelson, what about you?
I think the biggest adjustment for me was, as Megan touched on, just really embracing the attending role, realizing that now the questions are coming to you, not from you necessarily. Um, and really just trying to convey a command presence with your support staff. They look at you as being in charge. And even though you may be terrified because you've been in attending for all of 2 weeks, you still have to exude that confidence. And it makes for a calmer ER when that happens. It makes for a smoother workflow throughout the day. And while you may not know all the answers at that time, knowing where to find them and how to convey a plan to your staff is really important. That was a big adjustment for me coming out of residency when you're told, be here at this time, do this, this, and then maybe you're free to leave at the end of the day.
Yeah. What surprised you about that first year?
I
About yourself, you know?
I think the thing that surprised me the most is how adequately trained I was. And it just a lot of muscle memory in that first year. Like, oh, well, I've seen this in this rotation, or I've seen this in my residency clinic. And just feeling confident with the skills that I had acquired during residency to actually handle these different situations. That and being comfortable with asking my colleagues, bouncing case ideas off of them, have you seen this before? What do you think about this, X, Y, and Z? And just really trying to get over my own insecurity about appearing like I don't know as much, but realizing it's more of a collegial team effort to keep the wheels on the road, so to speak.
I was going to bring up something in that regard in this like ambient background of being an imposter, right? That imposter syndrome that creeps in when, um, especially in this role of like looking at an echo coming off of bypass and making a decision where you've always had someone over your shoulder kind of telling you like, yes, this is the right decision. When it's up to you and it's just you and the surgeon and you're trying to make that by yourself, you're like, is this the right call? and
Yeah.
and um and you feel like that you're an imposter in that situation, but you've been doing it for, you're ready and you're able to do it, but taking that leap and having that confidence.
Wow. Very insightful. When the stress was getting to you, or when you were having your first moments of, wow, this is a stressful first year. In fact, I can remember back to my first year in practice, I thought was probably my most stressful year. I don't know if you guys can relate to that at all, but when you were starting to feel the stress of practice, how did you take care of your mental and physical health during that transition? And maybe you were well prepared and you didn't have that kind of that stressful feeling that I'm talking about, but how did you take care of that during that transition? How did you set yourself up to have some good mental and physical health during that transition?
I'll go
Go
ahead
ahead,
and start,
Lindsay.
if that's all right.
You Yeah.
Um, with that, this is something that I still feel I somewhat struggle with trying to find that balance, right? That good work-life balance, which we all aspire to achieve. Um, Recognizing the signs of burnout weren't very easy with transitioning because as a resident, you're used to just you stay there until the work is done. You know, sleep when you can, eat when you can, but that's the lifestyle you have to become accustomed to. In practice, at least for me, it's a lot different. You know, the mentality is a lot different, and family medicine especially is very, I'd say, at least in our practice, very in tune with that work life balance. I have a great team of providers that I work with. We all kind of help each other out, covering call, taking extra shifts. So we can make baseball games and we can go to dance recitals and things like that. So the coverage is still there and it's a give and take type of relationship. I'm a big believer in when you're off, you need to be off. Try not to take work home. Obviously, that doesn't happen every time, but being able to have that line like, okay, it's the end of the day. I'm going to put on my wife and mother hat now and take off my doctor hat. Learning to say no is another thing that is coming along. Definitely better at it now than when I was first starting out because you want to take on everything and you want to show that you can do all of these different things. But as you go through your career, I think it's more important to kind of hone in on the things that you enjoy, the things that give you that satisfaction from, your everyday job. And being able to say no or delegate some other things becomes really important.
What about you, Dr. Lobson?
Yeah, I think a lot of what is good for physical health is also good for mental health. Mood follows action in so many ways. And I think for me, exercise or movement of some regard has been a great outlet. And being able to find that and even squeeze it in 20 minutes a day is such a positive change in my outlook, I think. I was listening to something the other day about the happiness quotient, which I love to think about. It's like maintaining this sense of productivity while making time for relationships and working out and working is always a hard balance. But as long as there's meaning found in it, I think there's this positive happiness quotient that you can derive from it, then it's a win on the scales of mental health. And that's kind of how I think about it. If something isn't if you're working a lot but you're finding meaning in it, maybe that's a good thing anyways. But maybe it's different for everyone as well.
Understand. Yeah, that makes a lot of sense. So so if you've had a moment of some really stressful times or even touched a little bit about burnout at any moment of either your training or during this transition, How were you able to recognize those signs or symptoms that, oh gosh, I'm touching the edge of burnout. What should I do? How were you able to recognize that? I'll leave this to either one of you to, you'll both get the question, but who wants to go first?
Lindsay, you want to go first? I think you kind of touched on that.
Sure. For me personally, I know I'm getting closer to that burnout when I realize my fuse is getting shorter, and minor nuances start to really annoy me, or I feel really irritated by it, like a last minute add-on at the end of the day. And when that happens, when I feel that kind of irritation and frustration kind of coming up, what I do is I try to take a walk. On nice days, I'll go outside, get some vitamin D, kind of, let that sunshine feel on my face a little bit. On days when that's not possible, I try to just take a little quick walk around our facility. Now, that's kind of something I can do in the moment when things like that happen. But if I notice it's building up over time, well, now there's several days in a row that I feel this kind of irritability, then I try to either plan a family outing or dinner with friends, give myself something to look forward to so I can focus more on that versus the minor inconveniences that seem to set me off.
Yeah, that's a really common one. Feeling a short fuse, just a little bit more irritable.
Mhm.
That's a really common one. What about you, Dr. Ralston?
I think I become um, more introspective and kind of close off from other people is how I find that it takes place in my life. When I feel like I have a lot of things to do, I'm working a lot, then I kind of cut off relationships. And I feel like the only thing that gets me out of that funk is to actually reach out and, you know, jump over that activation barrier of going to coffee with someone, getting dinner, just going over to someone's house when I feel like I have a lot to do, and just stopping and realizing that, you only have one life and you only have these relationships that you've made, and that's what it's about. And I think that refocusing and reframing that is really important. And that's how I found that it's manifested in my life, at least.
Yeah, another real common one. So shutting down and short fuse are really common symptoms of the beginnings of burnout, because you start getting really self-focused about, oh my gosh, I've got so much stuff to do, and I'm just going to internalize and I'm going to start pounding out that to-do list. And I'm just going to start getting on that treadmill and getting that work done. And then when somebody can interfere with that, having a short fuse about, don't interrupt me, I'm getting my work done, sort of feeling, both very, very common early signs of burnout before things are starting to veer off. So I applaud you both of understanding what those early signs are, because that's so that's such a good way of recognizing, and for early intervention, when you start to recognize, oh my gosh, I need something, sleep, rest, interaction, a break, so kudos to you for recognizing that. um, so do you have any mentors or coaches that you've worked with that have either helped you realize this, or just in your career? Careers in medicine, it's a long haul to get through our training. So who's helped you along the way, and how did they
Yeah,
support you?
yeah,
As
I
I
can
kind
say
of, oh, go ahead, Megs.
no, no.
Sorry.
Okay, okay. I was just gonna say, like, I at every stage along the path of my career, I think I can point to a singular coach, mentor, advocate. I know they're all different, but sometimes they happen in the same person. And that really prepared me and propelled me to the next stage of my career, either unknowingly or with, they knew, I didn't know. Uh Someone in my undergrad career, a PhD scientist, she really got me interested in basic research. I was at a D2 college, and it was smaller than my high school here in Omaha, and that really afforded me the opportunity to meet people early on. I started working with her in an ovarian cancer research lab, and she just really invigorated my desire to pursue intellectual curiosity as part of my big girl job, you know, like I love this idea of translational science, being able to take stuff from the bench to clinical practice. I don't do any basic stuff anymore, but I loved learning all of the techniques and the methodology. In medical training, I there were a few people within the anesthesia department that went out of their way to help show me around, encourage me to um, get involved with medical education projects, apply nationally when interviewing, because you never know who you're going to meet in interviews that could be helpful for connections in the future. I think a lot of what I learned in that time was that networking is a big part of medicine, even though I didn't see it at that point in my career, I think. And then in residency, I found a mentor that helped me get back into the research space, but a little bit more clinically focused. He's an academically trained anesthesiologist, ICU physician, and pain physician. He really provided a lot of depth and breadth of mentorship, dedicated research time, access to expertise for figuring out how to get an early start in that path. And so those are the three people that I can really hang my hat on as helping me get to the next stage of my career.
Excellent. And Dr. Nelson?
Yeah, I kind of alluded to this earlier. I've known this general surgeon for 22 years since I was a young child. He actually took my appendix out, and
I was
that
just going to
kind
say,
of
did he take your appendix out?
he did, and that kind of, I mean, that's really where my love of medicine was kind of born. I, was very fascinated with, everything that kind of went along with it. And he was such an excellent teacher. He takes on med students all the time, still does. So he very much has that teaching kind of mindset. And I'd ask him more questions. We kept in touch after all the follow-ups. He invited me to come and shadow with him. So I got to spend a day in the OR when I was in high school, which was fantastic. This was long before all of the rules and
Yeah,
regulations, are in place now. But I kind of felt myself, going back to him and, hey, what do you think about this? And hey, what do you think about that? And he kind of guided me, a little bit on my journey that way. I ended up taking a job in his office as a medical assistant, getting a little bit more of that medical experience. I got a surgery tech certification. So then I got to work with him side by side in the OR. And then when I was in medical school doing a general surgery rotation, I got the opportunity to come back and do a rural general surgery rotation with him again. And he actually introduced me to the former medical director at Henderson, which got the ball rolling for me to get an interview and ultimately my position. So I really credit him a lot with fostering my curiosity. And, instead of being, kind of brush off and, oh, annoying medical student just trying to get credit hours or whatnot, he really, encouraged me to, well, have you thought about this? And what about that? And you should look into, and it really kind of kept me going along on my journey. When I got to residency, my residency advisor was fantastic. I mean, just with the little nuances that come up in residency, as well as in life, and how to kind of blend those two, how to still be a
mhm,
person and
yes,
resident at the same time. She very much was a big believer in resident wellness and finding that work-life balance as much as you possibly can. I'm still in touch with her. I still bounce ideas off of her a lot. I see her more of a life coach now than a residency advisor, but I've been blessed to have such wonderful people in my life that have helped me along the way.
that's fantastic. I feel the same. I still admire, respect, and stay in touch with my mentors that have been through my career. I used to refer to my mentors as my personal board of directors. That it takes a board of directors to run a company, and I kind of felt like I'm a company, I'm a business that needs to be run, and so I needed my board of directors to help me along the way.
I like
So
that.
that yeah. And each board member had different strengths and different talents that I had to tap into to help me along the way. So What professional development strategies have helped you thrive so far? So is there any particular development strategies that you have worked with that you find have been helpful?
For me, I try to take advantage of any leadership training opportunities. Um, I I'm the medical director with Henderson now. And before taking on that role, I tried to seek out opportunities and really hone my leadership skills. What is going to make me a better leader? How do I make everybody happy, so to speak, but still keep the organization on the right track? um, and reading. I mean, that was something that, was all throughout my training and career to this point, just trying to stay as up to date as you possibly can. I feel like in family medicine, we have a good variety of different things that we see all the time. You'll never be able to read on every single topic that you'll possibly see in a day. But if I get, an interesting case or I'm starting to see several types of diagnoses, then I'll try to just refresh, my memory and, try to stay up to date on what the latest research is in that particular topic. And I feel like that kind of keeps me not not on top, so to speak, but on track with where medicine is moving. I'm also very interested in AI and to see how that can
Mhm.
apply to medicine as well. In a rural community, I feel like sometimes we're always the last to embrace some of the newer things in medicine. So I'm trying to bring that perspective to some of my partners as well, and staying on the forefront of that.
Excellent. Excellent. What about you, Dr. Robson?
It was it's funny, I was making some notes for this and I said the same thing. I said read journals, any type of journal. I read the daily monitors that come to my inbox for my specialty for Nebraska Medical Association, for nationwide medicine as a whole, to see, how the landscape is changing. Um, I also think that these connection points, like those little names, those tidbits, the information that you consume will provide you and serve you well when discussion with others about who are better for, who can help you with advancement and promotion. And when you're talking with someone else and creating that connection point, if you feel like you have this greater depth of the whole space, it's just you immediately can sense that. And I think that it only comes by reading and becoming knowledgeable about that space. I also think that not being afraid to meet new people, both at conferences, but also just sending a cold email. I was in residency and I needed help in a particular facet and domain of research, and I sent a cold email based on something I had read, like some little news article, and it turned into a really great relationship that has been rather productive for the past few years. I would have never thought that that was something that was possible, but just take a limb, go out on a limb and take just see what's possible.
You know what I lovingly like to call that is nerds unite, because when you find somebody who that is their thing, they love to talk about it. And so I've sent cold emails to people that, when you go to the bottom of a journal and you see that is their thing and you send a cold email, they love to talk about it. I want to learn, they want to talk. And it's like I always call that nerds unite because I love to be a nerd about things and I love to learn new things and I love to dive deep on a subject, because in my practice I had an unbelievable high number of children with heart defects in my practice.
Hmm.
And I mean, statistically, it was just weird how many I had. And for a while, I became like really studied on these heart defects in kids. And I had some cold calls and some cold emails with some heart specialist, and it was wonderful. And I I used to say I'm nerding out on this because I'll never probably have this case again, but I want to know as much as possible about this because not many people get to take care of a tetralogy of Fallot, and so I love that. And, I think it's really wonderful that you've done that, because, specialists and people who really know their subject matter, they do respond and they do like to talk about their area of specialty. So good on you for doing that.
Think it also
Um,
kind of comes back to this training mindset where you had like mentors or relationships assigned to you in some regard, like this formal mentoring pattern that was set up and structured for you. But having that transition and that shift in your mind to say, now I'm the one that has to initiate for the things that I need or the things that I want to get out of my career. And you have to go out and initiate to find those things. That's part of that shift too, I think, and something to learn, something I'm still learning.
yeah, yeah, absolutely. Yeah, and finding folks too at conferences and like you said, networking is so important. And it's a wonderful thing in medicine too, just being able to develop a network over your career of colleagues that are like-minded and really are a wonderful group of friends by the end of your career. So I applaud you for doing that so early in your career. Let's see. So, this is one of my favorite questions to ask in all different sorts of settings. But what would you go back and whisper in your ear to your younger self, piece of advice that you would give yourself, maybe earlier on as you're getting ready for this transition? Something that you know now that you didn't know then.
I think I'll go first, Lindsay, while you're thinking. Um, I think the advice that I continually try to give myself is to let myself like relish in those small victories um, as they come. Like even just I finished this page today, or I'm done with the day. Just like making any little any little victory a celebration, because I I often feel like I'm always on this proverbial treadmill of the next thing, or like this isn't done, it needs to be bigger. I'm very bad at taking my own advice in that regard. Um, but I do have some support systems that help me see those things. Like I live with a husband for 6 years. He is always making me stop and smell the proverbial roses. Literally, he cuts the grass and he's like, Meg, look, this grass is amazing. You should just sit down and really relish in the fact that we're living here, like we are in life together, and we you should take the time to celebrate with others. And I think that finding a little bit something little to celebrate every day helps you celebrate the big things too. I need to take my advice more, but
Wonderful, wonderful. Dr. Nelson, what do you say?
Yeah, I'm reminded of a quote that I loved. Always go the extra mile. It's never crowded. It takes no effort whatsoever to be kind, so always trying to keep that at the forefront. May not have all the answers, but know where to look. And it's okay to ask questions.
That's a good one. Yeah. You don't have all the answers, but at least know where to look.
Mhm.
That's a big part of being a family physician, but I'd say even just being a doctor, we have lots of resources at our fingertips. Just knowing where to look is half the battle, knowing who to call, knowing where to get that super, super subspecialist, knowing where to go for that answer. Um, that's a big deal. And knowing that you're not alone,
Mhm.
I think, that's one of the greatest things I think about the program that we offer here at LifeBridge is the fact that, we have a coaching program now for physicians for free that even if someone is feeling alone, they can call us and they don't have to be alone. But just even just on the patient side, just knowing that you're not alone, you can ask a colleague a question. You don't ever have to feel like you're the only one out there trying to solve this patient's problem. So that's very good. Are there simple habits that residents can start now to build into their, wellness thoughts now in their careers? Just simple recommendations that you would say to residents that are just starting to transition in their careers. Simple things they could start to put into their daily habits that you would recommend as they start to transition. Just any little nuggets that you could say to them, hey, start doing this now because it's easier to, build a habit now in your career than it is to start trying to do it later, like at my age.
Well,
I'd say the
Dr. Schaefer,
biggest thing, oh, sorry, go ahead.
I think of Dr. Schaefer, your maybe unconventional career. Maybe it's not unconventional, but just the path that you have gone on throughout your career where you were a physician and then you took a leadership role as a CMO, and then now kind of more of a life coach and giving back all of that knowledge that you've developed over the years. I think that keeping a hold of the passion for the little things outside of medicine can really translate well to what you did in your career in an unconventional way. It gives you the chance to broaden your skill set and your
Mm,
knowledge base beyond what traditional roles in academia or medicine would otherwise allow. And engaging outside of something the ordinary also prepares you maybe for a wider range of opportunities down the road that you can't see right now. Higher pay, more flexibility, more purpose, life satisfaction. I think being open to the things that you enjoy outside of medicine can maybe be there for you in the future, you know?
very true.
Yeah, to kind of piggyback off of what Meg said, I think finding a hobby or an activity that you enjoy outside of medicine is really important. That, as you go through your career, then becomes your escape, so to speak. When you need a reset or you need to just take a break from the medical life, you have this activity that you enjoy, that brings you joy, and not losing that. It could be very hard to lose those hobbies and activities that we enjoy, especially in residency, when we feel like our time is pulled in all different directions. The other thing I would suggest is don't be afraid to ask questions. Always be curious. Always be taking advantage of your preceptors on rotations, and even when you get out into practice, taking advantage of the colleagues experience that have been doing it for longer. There's a wealth of knowledge out there, and establishing those good relationships, being comfortable with asking those questions, that's just going to come back tenfold throughout your career.
Very good. Very insightful. Um, I'm curious, Lindsay, did we have any questions submitted?
I don't have any other ones right now.
Okay. Well, I'd like to just ask just a couple other questions of you that are a little off script, but I'd just like to ask. Dr. Ralston, how did you get into your area of medicine? What inspired you to go into your area of medicine?
I think when I think back to college, I I ended up in medicine in general because it was the competitive next step, which might be not, not the right thing to say on interviews. But it was what everyone was doing that majored in biology. And I thought it would be something that was generative. I would give back to the community. I did not know of anesthesiology as a field when I was going through medical school. We didn't have that experience until later in our medical school careers. And so I found a mentor within the field that showed me what it was like. They let me come shadow them in the OR. It felt like a team atmosphere. I grew up playing on teams my whole life, and feeling like there was another team in the OR in a medical setting really invigorated me, and I was drawn naturally to that. I also like the fact that it's a little bit of a mix of a procedural and physiologic mental exercise, so you get that little bit of both. In some regards, I am an introvert. And so sitting there all day with one patient in the OR by yourself can be fun for me. So those three aspects, I think, is how I ended up in anesthesia. Cardiac itself, you have, it feels like more of a team setting than a lot of other OR experiences because of the dance between perfusion, the cardiac surgeon, um, the OR nurses, then the anesthesiologist. It really feels like a concerted effort to get to the end goal of safely bringing this patient to the ICU, and I like that about it. So.
Oh, the interesting story. Um, I can imagine that dance. I've never heard it explained that way, but it makes complete sense about the team atmosphere and the dance of getting that patient back and safely to the ICU. That makes complete sense. Dr. Nelson, you spoke a little bit about your time with your surgeon. How did it was I'm surprised that didn't lead you into surgery. How did that lead you into family medicine instead of surgery?
Well, I actually thought that I was going to be a surgeon. That's what I said in all of my medical school interviews. I want to be a general surgeon in a rural area, and I am committed to staying in Nebraska. And until really my third year of medical school, like that was the plan. There was no straying from that. And I got out on my surgery rotation and it was fantastic. Everything that I thought it would be. I had family medicine then right after that. And it was just almost like this whole new world opened up. Like, wow, we actually see the patient again, like multiple times. This is a whole journey. It's not, I fixed you, goodbye. I'll see you in 2 weeks for your follow up and then out of my life forever. And I really became intrigued by how family medicine really is cradle to grave. Like you can take care of patients at any stage of life in any type of condition. And you've got all of these specialists that kind of, help out in a team approach kind of atmosphere to give the best care to this one individual patient. Um, I really discovered my love for family medicine during that rotation and how different it was from general surgery. So then the question became, okay, how can I blend these two things? And that again kind of led me into rule. I had the opportunity to do endoscopy. I had the opportunity to do surgical OB. Loved those things. I got my OR fix, but then I still got to see patients for the rest of the afternoon. Now, my practice has changed a little bit. Our hospital, unfortunately, decided to discontinue OB services for a number of different reasons. So we no longer offer that. And we added 2 additional general surgeons to our specialty clinic. So the volume for endoscopy wasn't there as the youngest provider doing it. I kind of got phased out a little bit with that. But there are still minor procedures that come up in the ER or in the clinic that I still get to do. Some of our specialists, tap me in to assist with surgery or one of our other providers as well. So there's a little bit of OR time sprinkled in there. But it was such a stark contrast between those 2 rotations. I remember I still feel how I felt when I first experienced that and just that my eyes were open to this opportunity.
You and I had the same path. I was surgery until I did family medicine. Then I was like, wow. Like
Yeah.
I had the same experience. And did, cradle to grave and loved
Mhm.
every minute of it and it had a really robust OB practice and that was just wonderful. I loved it. I had several families where I took care of 3 and 4 generations of the family and it was just amazing during that time. So yeah, very fulfilling to do that. So I can completely understand the change, but how wonderful. So what question have I not asked you both that you think is really valuable for anybody in the transition to know? What stone have I not unturned? You
I
think.
think, I haven't like officially made that transition. And my biggest question is what it's going to feel like on the first day that I'm working under my own license. Like it feels very intimidating. especially going to a new institution. I think that makes it even maybe a little bit more intimidating. But how do you go from one day being a trainee to the next just being, in charge? Right? Like it seems like a big step. And maybe it's not as big of a step as I'm mounting it up to be.
Well, you look for the attendee or attending.
Yes.
Right. It's always the answer.
No, it is, I remember the transition. It's a little unnerving, but you just have to remember you're not alone.
Mhm.
There's a network of people out there. If there's any way that you can get a couple colleagues that that you meet ahead of time, if there's anybody that you can meet, like to get a couple buddies to get them on speed dial. So if you have any questions or concerns, in the institution ahead of time, so that you have a couple tools in your tool bag, I think that's a really helpful thing. So and hopefully they've done that for you at the institution. They've given you a couple people in your department that you can call, so that you know, if you're stuck, you're lost in a place, you don't know how something works, your nurses are your best friends there, your charge nurses, they know everything. You go to the oldest, most refined looking nurse and you ask them the questions because they'll help you. Um, but getting a buddy or a colleague that's in the department, and then you start reaching out and you start meeting other people from other departments, getting their cell phones so you know that you can call them, you have a nice meet and greet. Um, have coffee with people when you can, just to really solidify relationships around the institution so that you can call them and they'll pick up the phone when you have a question or a concern. And just build out your little network in your phone so that you have this little safety net of people that you can rely on and trust that they'll answer the phone and answer your questions. Those are great steps for anybody when they go to a new institution, not just when it's your first day as an attending. So really, just know that you are trained, you are there, and you're going to be okay, and you're not alone. That's the biggest thing. But you're just going to a new place, and for them, you're just the new person. They don't know that you're the new person. It's your first official day.
Dr. Schaefer, your life coach is coming out.
I can't help it. Lindsay, what have we not said? Or I'm sorry, Dr. Nelson, not Lindsay yet.
Yeah, no, you're exactly right. Trying to establish those relationships early on can be very beneficial. Because I signed out here so early, I had the opportunity to moonlight out here. So I'd pick up some ER shifts, which made my colleagues then, oh, wow, she's going to take these ER shifts for me? Absolutely. That sounds like a real good fit. But it allowed me to get to know the support staff a little bit better. I got to know my hospital nurses a little bit better. They kind of learned my style. So then on day one, my official day, we had already kind of established that relationship. It wasn't like, oh, this is a brand new doctor. We're going to have to get used to how she does things and what she prefers. I had already kind of built up that relationship prior to coming in. And because I was still, moonlighting and still in residency, I had all the resources from my residency team that I could fall back on, my faculty specialists that we had worked with out in Lincoln, which turns out is where we often transfer patients from our critical access hospital. So that kind of helped foster that relationship too. And then I was able to get the contact information for my colleagues, so I could rely on them. Hey, I have this patient here. She's a patient of yours. You know her history a little bit better than I do. Can you kind of help me out with that? And that, again, just helped build up that relationship. So on day one, we kind of joke about it now. I got a badge and a schedule. That was my orientation. And just to clinic I went. And it was like I had been doing it for so long already. The transition seemed a little bit easier.
Great. That's really great. So we've talked a lot today and about a lot of different thoughts and ideas and backgrounds. And I guess if there's one one piece of advice that you would give someone finishing up and going, what would it be? Um, and I'll just leave it to you guys to think about that just for a second. So your parting words of wisdom, your big piece of advice for the transition. And Dr. Rolfson, you could do it for the transition or to a new fellow, but what would be your recommendation?
I've been trying to, I read before bed, and I've been trying to read some classics. And I think something that has struck me is how there's really nothing new. It's just packaged differently. You know, things happened the same in the 1700s. It just looks a little bit different with AI and you know, all the advancements we have, I think. But part of part of what is reassuring in that is that there's people that are older and wiser than me that have been through these things before, and there's nothing new. Like, they have the same experiences. They can tell you how to approach certain experiences and rely on them. I think really harness the collective wisdom of people that have been through it before, and that can shape your life path, because that's beautiful too.
Beautifully said. Dr. Nelson?
Yeah, my biggest piece of advice, stay curious. Always ask questions. If you don't know the answers, know where to find them. Rely on your resources. Like Meg had touched on, they've been doing this for longer than you have. They've got some insight. So, utilize those resources. Nearly all the doctors that I've worked with have always been willing to teach. So you can find um, those physicians pretty easily, and they're always appreciative of when they can impart their knowledge too. Have a hobby outside of medicine and continue to do that hobby as, as much as you're able to with a new schedule, but always keep that kind of in your back pocket for a stress relief as needed.
And something that I recently learned, most of the novel ideas in research, at least, you know, this different realm, they come from early career people, because your brain has some plasticity. There's a lot of dopamine. There's a lot of fire for curiosity, like Lindsay was saying. And so harness that. I think harness the youth, maybe, right? And take advantage of the fact that now is the time to craft your career or find new possibilities, or, you know, find something new.
Excellent. Lindsay, anything that you want to ask that I haven't asked?
Well, I'd just like to share a couple things really to build off of both of you. You both mentioned using resources and reaching out to colleagues. And I just wanted to share this quick for those who are watching the call after or have been listening, that you do have those resources, and LifeBridge is one of those. And so just wanting to know that this is available. As Dr. Schaefer mentioned earlier, this is a free and confidential peer-to-peer physician coaching that we offer at LifeBridge. It's for any Nebraska licensed physician or resident, and you can call the confidential line here to get paired with a coach. If it's something where you need a safe space to talk about things or bounce ideas off, know that we did pass legislation in 2023 to make sure that this is a protected under statute program. And so anyone participating in this, it's protected against discovery of any participation. So you're not obligated to disclose your involvement to any facility or hospital or accreditation organization, insurer. And sometimes people just need a safe space to know they can talk about this. But definitely using our coaches, they have a wealth of knowledge and experiences. And so it's a great connection, like Dr. Rolfson and Nelson both mentioned, that make those connections. And we're able to keep this program at no cost, thanks to the generosity of our sustainability partners. So we've got a lot of local hospitals and health systems that are on board that help us to do that and have really prioritized physician wellness as well. So, but I do just want to thank you both for coming on. This has been extremely eye-opening, and you guys have some great experiences, and we'll definitely be sharing this out with all of our residents and early career physicians.
Thank you both so much, and all the best to both of you. And Dr. Rolfson, a smooth transition for you and a smooth move. And Dr. Nelson, just thank you for being a rural family practitioner and doing full service. I think it is just awesome.
Thank you
It
for
was nice
having
to
me.
meet all of you.
Yes.